October is Breast Cancer Awareness Month. The American Cancer Society estimates that this year alone, more than 3,200 women will be diagnosed with breast cancer in the state of Oklahoma. Doctors say it is so important to get screened in order to catch the cancer as soon as possible. This afternoon, Dr. Clint Merritt from Hillcrest Medical Center is here to talk more about what we need to know when it comes to monitoring for breast cancer. Dr. Merritt, thank you so much for being here. Let's talk about how often women should get screened or to get a mammogram. Let's talk about the age too. What should that look like?
Sure. So one of the things that we look at when deciding when a woman should start mammography screening is based on their personal risk for breast cancer. An average risk woman is going to be recommended to start breast cancer screening with mammography at the age of 40.
Okay, and say there is family risk or other indicators perhaps earlier than 40,
right.
Yeah?
Yeah, so certainly women who have a family history of breast or ovarian cancer should seek an appointment with their primary care doctor or a breast care specialist. The idea would be is women who are identified as higher risk than normal may need to start screening mammography earlier than the age of 40.
Sure, well, let's talk about why it's so important to get screened on a regular basis. Knowledge is power, and as soon as you get that information and say there is a spot or something there, you can start attacking as soon as possible.
Exactly, and that's the goal of screening mammography. The goal would be to identify a problem in the breast as early as possible. We know that survival outcomes in breast cancer are highly linked to how early of a stage of diagnosis we make, and so the sooner something is diagnosed, the better the overall outcome will be.
Sure, well, women are always taking care of family, taking care of things, keeping the household running, and there's that thought in the back of the head, well, oh, I've got to go get screened, but I'm too busy. Mm-hmm. Or you're too scared to, what if? And you need to take all of that out and say, in order to take care of everyone else, you've got to take care of yourself first.
Absolutely.
So maybe take the taboo out of going and getting screened. It's nothing to be worried about, and it's not intimidating like some people think it is. So what are some of the warning signs? Let's talk about that women should look out for when it comes to breast cancer.
Sure. So warning signs in the breast that we would be concerned about and that would need to be treated or seen by a physician would be any increasing breast pain that's new for the patient. A palpable mass in the breast is always concerning. Nipple discharge that's new onset, especially bloody nipple discharge, would be very concerning. Skin changes of the breast that are associated with a palpable mass are very concerning as well. And I tell all women who come into the clinic, I say, if you are concerned about your breast, something doesn't seem right, the best thing you can do is either seek your primary care doctor or find a breast care specialist closest to you.
Absolutely, because best case, you saw something, you felt something, you go in and it's okay. Well, good thing you did.
Absolutely.
You go in the second that you feel like something is off, and you know it is. No one knows your body like you. Finally, let's talk about this. It's not as common, but also men, they can develop some forms of breast cancer. What signs should men look out for?
Yes, a lot of men, I treat a lot of men with breast cancer, and I will tell you it's very common for men to think they cannot get breast cancer, but men can indeed develop breast cancer just like women can. And the warning signs are very similar. Palpable masses in the breast, nipple discharge, skin changes, or pain are the most common ways that men will also present with breast cancer.
Okay, very good. Very important conversation to have. Dr. Merritt, thank you so much for coming on today.